Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Once there's your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines from today, November 2nd. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Okay.
In the United States, we are seeing about an average of 38,000 positive new cases every single day, with like a 2% increase over the last 7 days. In the United States yesterday, we saw about 29,000 positive new cases, with the hospitalizations increasing by 2% and the death rate fortunately decreasing by 10%. In Illinois, we are seeing a 7-day average of about 2,000 positive cases every day, with the cases increasing by 26% over the last 14 days. Hospitalizations have increased by 13%. The death rate has also increased by 21%. And Illinois sees about 2,000 cases every single day. So what can you tell us about this increase in Illinois and what is going on with the rest of the United States?
We're not sure if this is just a natural occurring sort of wave of, reporting and not doing tests as often. So it's hard to say, but it's stable at a relatively low level with still with deaths over 300 people, per day dying in the United States. Remember, that's 3 times as many that die from the flu. So it's kind of down at kind of a, low level infection rate, but it would be better to go down even further. It's something we're going to have to live with. So, where the bottom really is, where this is going to end up, we don't really know. It's probably not going to go away. It's probably going to become just like the flu. It's going to be another one of these diseases. And, that's, we're going to have to live with that.
Yeah. No, absolutely. Well, going into our first major headline is that Shanghai's Disney resort closes abruptly over a minor COVID outbreak with visitors stuck inside. So what can you tell us about what happened last Monday?
This is at Shanghai Disney Resort. So this is in China. They have very strict rules about quarantining and isolating people. And they institute them like instantaneously. People get stuck inside the park. They can't get out without having a test done. So, their philosophy is very different from everybody else in the world. This, no COVID philosophy. And they're going to suffer the consequences because it just is not going to hold up long term, because this is not going to go away. So they're either going to just live like this forever, or they're going to loosen things up a little bit. More people will get infected, but more vaccines need to be given. We don't really know the status of the vaccines. The original rollout in China was actually very good, but we don't know what's happening with the boosters and whatever. Hong Kong was a disaster. Older people in particular didn't take the boosters, and they're the ones that needed it. So it remains to be seen, but the China experiment, no, their death rate overall is very low. So, they need to be commended for that. It works, but it's just so painful.
Right. And then going into our next big headline, the pandemic, quote, immunity gap is probably surging in RSV cases, scientists say. So what did all of this masking actually do for the last almost 3 years?
Yeah, so what happened is kids typically get exposed to all sorts of viruses when they're very young, including respiratory syncytial virus and but many other viruses. Well, during COVID, with all the mitigations and all the masking and all the isolation and the closing of schools and the people being more and more careful, well, what that did is it lowered the rate of all these infections, like respiratory syncytial virus. I don't know if you remember, in 2020, 21, the flu cases were almost gone. They had really just almost disappeared. Well, when your behavior goes back to what it used to be, and the mitigations are not in place anymore. Very few people are wearing masks, even on airplanes and the like. What happens is now you're going to be exposed to all that stuff again. Now, in the case of kids, if they haven't been exposed, the first time they get the infection, the more severe it is. So they're going to get sick either earlier or later, and they're getting sick later. And so you have a bigger population at risk for RSV, for example. And so that's why the pediatric hospitals are so full, because it's not just 1 year's worth of kids, it's actually like 2 or 3 years worth. So it's been quite challenging for the pediatric wards and pediatric hospitals to keep up with all these sick kids with respiratory infections.
Yeah, no, absolutely. And going into our last COVID headline is that CDC Director Rochelle Walensky tests positive for COVID again after taking the antiviral pill Paxlovid. So can you tell us what's happening to Dr. Walensky and the rest of the US who takes Paxlovid?
Well, this, as we've reported before, happened to myself. I took the Paxlovid, and I happen to have access to many tests because we're doing studies with tests, and I tested myself every day. And sure enough, when I took that Paxlovid, I felt better, and the test turned negative. This is the antigen test, the rapid test that you do yourself. And then when I finished the Paxlovid, everything was good for about 2 days, and then boom, I felt sick again, and I was still testing myself, and I turned positive again, and I had like a whole new infection that was actually worse than the first time. So the same thing happened to Dr. Fauci. The same thing happened to Rochelle Walensky. I mean, this is not just a random event. This is a pretty common event. Not super common, but enough that nobody should be surprised about it. There's been some recent studies. First we thought, well, maybe you should be treating with Paxlovid for a longer period of time. And that 5 days is just too short for some people. The 5 days, I don't know where the original 5 days came from, but that's what you give for Tamiflu with the flu. And it's a 5-day course. The whole, these respiratory infections have the virus go up very quickly, and it goes down like within a week. It's all quick. So 5 days was, a reasonable number, but it might not be the correct number. However, they're seeing relapses in people who didn't even take the drug. In other words, they're having a period of symptoms, and they feel sick, then they feel better, and then a few days later, a week later, they get sick again. So a double wave type of thing. So it's not necessarily due to taking the Paxlovid. It's just the nature of the beast, and it's interesting that the leader of the NIAID at the NIH and the CDC both had the same thing happen. I mean, it's just. In the case of Dr. Fauci, he admitted that he took another course of Paxlovid. And of course, the FDA said, "No, don't take it." Why would you not take it? But anyway, but it's kind of all over the place. But people should just be aware that there are a minority of individuals who get sick, whether they take Paxlovid or not. They can have this sort of double wave. And the dangerous thing about that is that when they're having that second wave, they go back to being contagious again. So that whole 5-day and 10-day rule, you have to kind of start over.
Right. Well, that's pretty scary. Well, going into our viewer submitted questions, the first question being, does the bivalent booster entirely replace the other boosters that we've been taking?
As of now, yes. So the bivalent booster is half of the old one and half of the new one. The new one is based on the BA4 and 5 Omicron variants. Now, there's been some very interesting studies, very small, like 40 patients or so, from 2 different groups that have looked at the immunologic response to having a regular booster versus having the new bivalent booster. And as far as now these immunologic tests are like intense laboratory tests. We're talking about just measuring things in your blood. This is not, how the patient is doing or anything like that. Everyone's doing fine. But on the immunology side, there was like no real difference. Now, granted, 40 patients, what does that mean? But in these type of tests, you don't have to have hundreds of thousands or tens of thousands of patients to actually figure out what's going to happen. So that was a little bit disconcerting. Those groups are very reputable and respectable. You know, everybody believes the results, but it was interesting to see that, you know, the response was really pretty much the same. And, you know, just the body has responded to the first one, the first vaccine. And, you know, that sort of just covers maybe many of the long-term effects of vaccines, and that tweaking the vaccine a little bit is really doesn't do very much, if anything. So, you know, maybe we need a whole completely different look at the booster phenomena. But this is an important information because, you know, perhaps we can study a better way to do the boosting, and that the kind of the way we've always done it over time, like with the flu, where we change it every year, or, you know, the other vaccines that, you know, kind of just give the same vaccine again in 6 months or whatever. Maybe we have to, you know, just go back to the drawing boards and figure something else out, or try it a couple other different approaches.
Yeah, no, absolutely. And going into our last viewer submitted question is, how long does COVID immunity last? Will a second illness be worse? And how do I prepare?
Yeah, well, this is kind of the question of the hour. How long does immunity last? All we know is that it doesn't last forever. Very similar to the flu. It does wane, and in people with immunodeficiencies, it wanes faster. But you know, the big question is, how often do you have to have a booster? So I just had my 5th shot, my 3rd booster the other day. How long is this going to go on, and how often do I have to take another one? We don't really know. It's looking like, especially with the data we just talked about, that perhaps maybe you only need this once a year, because you're not really preventing infections. You're preventing serious disease still. But all this will play out as more and more people study what happened to all the people that got the bivalent booster. Because remember, that was approved based on basically laboratory tests. And, you know, we're just collecting the data in humans now, just like with the flu vaccine. There's nothing special about that. And we have different vaccines out now. We have the Novavax vaccine. It's a very different kind of vaccine. You know, maybe switching in and out with that one would be helpful. I'm not suggesting to do that, but I mean, to just say there's got to be some other way to look at this, and that is being done now. And we'll be able to at least have a better answer than we do now in the not too distant future.
Yeah, I hope so also. Well, Dr. Murphy, those were all of our COVID questions for today. We will see you next week.
All right, see you next week.
Thank you.